Welcome to our fifth section in Joint Health and Degenerative Disease, where we look at an assortment of supplements. In the next 10 minutes, you'll learn about the challenges with supplements, the clinical proof behind joint supplements, and a review of commonly recommended joint supplements. There are many supplements available, both in veterinary practices and retail stores, for joint health and support. Unfortunately, most of these supplements lack clinical data to show safety or efficacy. Very few supplements on the market today have clinical efficacy data. Efficacy will be based on assumptions. Most companies rely on extrapolative data from other researchers or other companies. These external data may be from clinical research in artificial laboratory cell culture models or mice models. Preliminary benchtop models are an important starting point, but not the end point. Basing efficacy on assumptions leaves holes in the needed information. Consider one discovers a supplement which has reported anti-inflammatory properties and then assumes this will translate into managing joint disease. The supplement itself has never been through a trial to demonstrate efficacy. This means there is no safety data with respect to side effects or drug interactions such as other supplements or common pain medications. Data provides confidence. Anytime you recommend a product, you are endorsing it. If that product fails or causes an adverse event, the client may no longer 100% trust the clinic recommendations over a friend's opinions or Dr. Google. Confident endorsements require data. Differentiating side effects from underlying disease requires data. Efficacy data sets the clinic apart from the retail store. Clinical data allows you to meet the challenge of differentiating the selected supplements in your clinic from online or retail store products. When you have clinical data, you can easily answer these two common questions. Is your product better? How do you know that your product is better? There are a lot of claims from various products, but is there any data? Let's get to the clinical data cliff notes on the various supplements. We're going to look at turmeric, fish oil, glucosamine and chondroitin, ASU, antinol, undenatured collagen, and Boswellia serratu. Turmeric cliff notes. Lots of press, but does it really help? There is a single clinical trial involving 61 dogs divided into placebo and treatment groups studied for 2 months. Peak vertical force, which measures the impact as dogs walk across the floor, and owner assessment input was recorded. The results showed no statistical difference in peak vertical force between the treatment group and the control group, and no statistical difference in owner assessment. We hear about fish oil all the time. Is fish oil one of the best supplements to add to a pet's diet? Diets containing supplemented fish oil have shown clinical efficacy. Fish oil has shown to decrease the need for rescue NSAID therapy, but did not cause significant pain relief. Specific high doses of fish oil are recommended for managing osteoarthritis. Patients need a gradual increase in order to tolerate a therapeutic dose. Depending on the product, this may be cost prohibitive. For example, a 25 kilogram dog needs over 3,000 milligrams total EPA and DHA dose, while a 50 kilogram dog would need over approximately 5,000 milligrams. Glucosamine and chondroitin is another commonly recommended joint supplement. Glucosamine is typically shellfish derived, while chondroitin is from pigs, cow, chicken, or shark cartilage. A recent well-designed study from 2017 evaluating 60 dogs receiving treatment versus placebo for 90 days showed no significant benefit in activity or owner assessment. In 12 dogs evaluating osteoarthritis post-cranial cruciate repair, treatment did not document a clear benefit between placebo and glucosamine and chondroitin. It is possible that there are mild positive effects delaying the inflammatory process of the synovial membrane. 2 older studies have shown some subjective reduction in pain after 1 to 4 months. Be aware this may be dose and product dependent. There is no strong gait analysis data using force plates. Combination therapy is considered better over just glucosamine or chondroitin alone if considering therapy. No adverse effects were expected. If no improvements are seen after 3 to 4 months, it's unlikely to be of benefit. Consider cost of 3 to 4 months of therapy. UC2 is a specific patented form of denatured chicken sternum cartilage high in specific amino acids. In 2 trials, UC2 combined with glucosamine chondroitin demonstrated statistically improved mobility and decreased pain. Undenatured collagen UC2 demonstrated statistically significant efficacy within 90 days as a single agent when compared to a placebo. Noted to be both safe and well tolerated. Again, consider dose and source. Avocado soybean unsaponifiables, or ASU, is an extract with a specific ratio with the main component being phytosterols. There are 2 studies within the literature. The first study did not assess dogs with arthritis or pain. The study measurements of growth factors in the joint has unknown clinical relevance. In a second study, anti-inflammatory and chondroprotective effects within a canine experimental model of arthritis were documented. However, leading experts note more research is needed. It is considered to be safe. Boswellia serratu is a natural resin extract. There's a single study in the literature that showed a positive response, but the study was not placebo-controlled. Assessment was subjective. Evidence is questionable given no placebo group. MSM is sulfur-containing compound in small quantities in the body, the breakdown product of DMSO. There is no published research in dogs, the dose is unknown, and safety is unknown. Green-lipped mussel, or Perna canuliculus, is often seen in a powder which contains protein and a variable amount of marine lipid. Extraction methods will affect the active ingredients as they are very heat sensitive. There are 3 studies in the literature looking at enriched diets, but no studies on the powder alone. Positive effects were noted, including a 2013 placebo-controlled trial evaluating force plate results. Dosing as a supplement needs to be extrapolated from these trials done on diets. Noted as a strong tasting, but considered to be safe. PCSO 524, the active ingredient in Antinol, is a patented active ingredient oil extract from green-lip mussel in a capsule form. It contains a unique formulation of polyunsaturated omega-3 fatty acids beyond EPA and DHA. Mechanism of action impacts multiple pathways of disease. It is far more potent than the powder, meaning lower doses are needed. It has no protein component with respect to allergy concerns. Antinol can be part of your confident recommendations. There are 4 directly applicable, peer-reviewed, published trials pertaining to canine and feline joint health showing positive results. Onset of action is within 2 to 4 weeks. Antinol outperformed standard fish oil supplementation in a blinded, randomized study. No effect was seen in the fish oil group after 12 weeks. There are 2 safety studies in dogs and cats, along with heavy metal and toxin analyses. Go forth with confidence now that you have the data. When evaluating the supplements on your shelves, ask yourself, is it clinically effective? How soon can it work? Is it safe? Is it better? Any product on your shelf carries your endorsement. Ensure the products you stock are worthy of this. Check out our final joint section for an in-depth look at green-lipped mussel.